Hi, this week we are going over a very common first trimester concern, bleeding in early pregnancy.
Yeah, we're going to look at what are the most common causes, does it mean you're going to have a miscarriage, and is there anything you should be doing to prevent it? We're going to cover all of that today, as well as talk specifics about subchorionic hemorrhage.
Which I actually had with this pregnancy. So if this is your first time meeting us, I'm Sarah. I'm a board certified OBGYN and mama.
Yep, I'm Kurt. I'm a board certified pediatrician.
And we are the Doctors Bjorkman. Welcome back. This week we are going to talk about bleeding in early pregnancy and cover information about subchorionic hemorrhage, as this is one of those diagnoses that leads to many questions and uncertainty. I always tell my patients that bleeding in the first trimester is never normal, but it is really common. Of course, if you are experiencing it, it can be very alarming, and I'm sure you have many questions, which we hope to cover today.
Okay, with that, so let's get right into our first question. Does bleeding during pregnancy always mean that there is a problem?
The short answer is no. Vaginal bleeding during pregnancy has many causes, and we are going to talk about the most frequent ones. Some are serious and others are not. As I mentioned, bleeding in early pregnancy is very common, and in many cases, it does not signal a major problem. Bleeding later in pregnancy can be more serious, and of course, call your OBGYN if you have any bleeding at any time during your pregnancy.
Yeah, absolutely. Now, I feel we get asked about bleeding in pregnancy often. How common is this?
So it's very common. Bleeding in the first trimester happens in 20 to 40% of pregnancies, and causes can vary, as can the type and frequency of bleeding. So light bleeding or spotting can occur 1 to 2 weeks after fertilization, when that fertilized egg is implanting in the lining of the uterus, called implantation bleeding. And the cervix may also bleed more easily during pregnancy because more blood vessels are developing in this area, and it's kind of more delicate or fragile. So because of this, it is not uncommon to have spotting or light bleeding after sex or after a pap test or pelvic exam.
Huh. That's interesting. Okay. So with that, what are some things that can cause bleeding during early pregnancy?
Problems that can cause bleeding during pregnancy can be infection, polyps, fibroids, early pregnancy loss or miscarriage, and ectopic pregnancy. Something that can be seen on ultrasound when investigating this bleeding is called a subchorionic hemorrhage or hematoma.
Bleeding and cramping can be signs of miscarriage, but about half of women actually who have a miscarriage do not have any bleeding beforehand. We actually talked all about miscarriage previously in an episode about miscarriage that we will link for you here.
Yeah.
Interestingly enough, bleeding related to pregnancy loss or threatened miscarriage is the most common cause of bleeding in early pregnancy.
Yep. It's important to take a second here to talk about ectopic pregnancy. So ectopic pregnancy, meaning that pregnancy is implanted in the wrong place, usually the fallopian tube, is a rare but life-threatening cause of bleeding, occurring in only 2% of pregnancies. Because the rupture of an ectopic pregnancy is a true life-threatening emergency, this has to be ruled out in all patients with bleeding in early pregnancy. And so this is why it's important to let your OB know about first trimester bleeding, especially if you haven't had a confirmation ultrasound yet, to see that pregnancy is located in the uterus.
Gotcha. So what is a subchorionic hematoma or an SCH?
A subchorionic hematoma is a collection of fluid or blood between the chorion, so the early placental tissue, and the uterine wall. So when the early embryo implants, it has to invade into the endometrial tissue and form a connection between mom's blood vessel and baby's blood vessel. And it does this by burrowing into the uterine wall and releasing different enzymes and proteases to kind of chew in and open up and connect these blood vessels between mom and the embryo. And so this is a delicate and normal process, and it's not unexpected that we might see evidence of bleeding on an ultrasound if this process isn't perfectly balanced. And maybe one blood vessel doesn't perfectly connect and there's a little bleeding behind that forming placenta.
Gotcha. Now, subchorionic hematoma may be noted incidentally at the time of initial OB ultrasound or during follow-up ultrasounds, such as when women present for bleeding in the first trimester of pregnancy.
Right.
Actually, and here is a picture of Sarah's subchorionic hematoma. And this we found incidentally during our first 6.5-week scan, meaning that she hadn't had any bleeding or any symptoms, but it was still seen and noted on that initial ultrasound. Now, these SCHs usually resolve on their own within days or weeks, but can take longer to resolve.
So I had a subchorionic hematoma with this pregnancy, and I hadn't with my first. And I think I actually had scanned myself around 5 weeks and hadn't noticed it. So when I went for my kind of 6.5-week scan, there it was on this ultrasound, and I had not had any vaginal bleeding or any symptoms, cramping, anything like that. And our sonographer was like, oh, starts measuring and sees this little subchorionic hematoma. And it was an IVF pregnancy, and as we've kind of talked about, it is more common in IVF pregnancies. But it was still surprising, and it makes you a little nervous. And I, of course, like many of you, probably went out and Googled subchorionic hemorrhage again to kind of refresh my memory on, hey, what does the data say about this? Because the first thing you think of is, am I going to have a miscarriage? What does this mean? And so I went out and kind of did a lit search again and reminded myself that this doesn't necessarily increase your risk of miscarriage, but it is something you just kind of have to watch and wait and see what happens. And so it did resolve on its own. I never had any bleeding, but totally understand that it can be nerve-wracking. The impact of subchorionic hemorrhage on early pregnancies has been disputed. Some prior studies in the fertile population have shown increased rates of pregnancy loss, while more recent studies kind of demonstrate no increased risk.
That's really interesting. Now, after decades of documenting and studying subchorionic hemorrhages to see if this increases risk of miscarriage, the studies that are out there have been mixed and each have their limitations. Studies have looked at the size of the blood collection, some measuring the length, they're comparing it to the size of the gestational sac. Some look at how far along the pregnancy was at the time of bleeding. They look at the location of the bleed, maternal age, or whether there was also vaginal bleeding associated. And honestly, these differences make it hard to compare and come up with a definitive answer.
One of the biggest and more recent studies that was done in 2019 looked at the risk of miscarriage associated with subchorionic hemorrhage in the first trimester. So in this study, they looked at patients who had a subchorionic hemorrhage with bleeding and those who had no bleeding but did have a subchorionic hemorrhage noted on a first trimester ultrasound. And then they compared that to those who had no subchorionic hemorrhage at all. They found no link to pregnancy loss under 20 weeks. So said another way, in this study, those with subchorionic hemorrhage were no more likely than patients without subchorionic hemorrhage to have a miscarriage.
And they also looked at these same patients out beyond that 20-week pregnancy mark and found no increased risk of adverse pregnancy outcomes or complications later. So no increased risk of growth restriction, abruption, or premature rupture of membranes.
And the lack of increased risk of miscarriage or later pregnancy complications was true no matter the size of the hemorrhage or number of them. And so again, this study was looking at singletons, not multiples.
Now, interestingly enough, for a couple who just went through IVF and for a fertility doctor, the prevalence of subchorionic hemorrhage is often higher among the infertile population, affecting between 18 and 40% of those pregnancies in recent studies.
So this is a very common occurrence for IVF patients, but more reassuring data has come out recently. A study published in 2022 looked at subchorionic hemorrhage in infertility patients and found that SCH did not increase risk of miscarriage, even if patients reported bleeding. However, if the patients with SCH reported bleeding and cramping, they did have a slightly higher risk of miscarriage.
Another study published in Fertility and Sterility, one of the leading journals in IVF here in the US, found a higher incidence in infertile patients of subchorionic hemorrhage, being 18% in that group as compared to only 4 to 8% in the general population. But interestingly enough, this study found no higher risk of pregnancy complications and no difference in live birth rates, miscarriage, or birth weight of the infant. So with all of that, what are the big takeaways about early pregnancy bleeding or subchorionic hemorrhage?
So subchorionic hemorrhages are common in early pregnancy and can be stressful and scary. Most of the time they resolve on their own. There is nothing that you did or didn't do to cause this. There is no treatment. You just have to watch and wait to see what happens. And most importantly, recent data suggests that it does not increase your risk of miscarriage. Okay. It is okay to continue your normal activities. There is no evidence that sex or exercise can cause these. However, your OBGYN or fertility specialist may recommend some pelvic rest until the bleeding goes away. There is, again, no evidence that bed rest or certain foods or supplements can help make it go away. And so if you find yourself experiencing a subchorionic hemorrhage or early bleeding, it's a great time to work on some coping mechanisms, seeking support and help from your friends, your family, and partner as you work through this kind of uncertain time.
Yeah, we definitely understand some of that uncertainty ourselves. We really hope that this information has been helpful for you if this is something you're going through or worried about. At the end of the day, if you have concerns, talk to your OBGYN, and we will be here for you guys next week. Bye.
We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.